Setting clinic. You see a son or daughter of 80-year-old woman who does not like to have blood test, and her daughter wants to know why the blood test is so important and why it is necessary. Now let's look into the task. First one says give reasons for blood test. Check general status of health, liver and kidney function, and impact of the medication. Second one says explain blood tests are part of normal routine health check such as blood pressure check or cognitive function test. Third one says explain the greater risk of bruising in all the patients. More sensitive skin, less pronounced pain, usually harmless, and fade quickly. Paracetamol for pain. Fourth one says explain the details of fasting requirements. No food for at least 8 hours. Continue drinking water. Take usual medications as normal. Fifth one says explain the need for GP appointment. Discuss the result of treatment. Review medications, etc. Recommend son or daughter's involvement. Attend blood test. Follow-up appointment with his or her mother. Now let's begin the role play. Hello, good morning. I'm Emily, one of the registered nurses working in this clinic. What brings you here today?
Good morning, nurse. I'm here to understand more about the blood test because my mother takes her blood tests frequently as per her doctor's advice. However, I don't really understand why does she need so much of blood tests frequently.
Okay, I understand. You can say, do not worry. I'm here to help you. How may I address you for a better communication?
You can call me Mary.
Thank you, Miss Mary. I'll explain you the importance of blood test. Before moving ahead, can I ask you a few questions regarding your mother?
Yes, nurse, please.
Okay, tell me how old is your mother?
She is almost 80 years old.
Please tell me about her current medical condition.
She has been diabetic and hypertensive for the last 15 years, for which she is on medications.
Thank you for sharing your valuable information. Now let me explain you why the blood test is important. First of all, blood tests are usually done to measure or examine cells, chemicals, protein, or other substances in the blood. We normally do blood tests in order to understand the general health of a patient and also to understand more about the liver and kidney are functioning well. As you told me that your mother is taking medications nowadays, this blood test also reveals if there is any impact for her current medications. So based on the result, we can change the medications if required. But do not be overly concerned. It is generally part of routine health checkup like blood pressure check and cognitive function test. I hope you're following me, Miss Mary.
Yes, nurse, I understand the importance of blood test. However, my mother doesn't like pricking or piercing the needle to take the blood samples as it causes bruising and pain after every blood test. So what can be done to manage it? And why it's happening?
I appreciate your concern regarding your mother, Miss Mary. As you know that your mother is almost 80 years old. The bruises are something very common in older people. It happens because the skin is very sensitive and the veins are less pronounced. But you do not have to be worried because it is quite harmless and fade away quickly. In case your mother experiences any pain, you can ask her to take paracetamol for pain relief after consulting with her doctor. Do you have any more questions for me?
Yes, nurse. I came to know that there are some requirements before the blood test. Can you please explain me a bit more on that?
I acknowledge your concerns, Mary. Yes, there are some fasting requirements before the blood test. That is, your mother is not allowed to take food for at least 8 hours. However, she can continue drinking water and usual medications as normal. It is also a good idea to take your mother for blood test early in the morning so that she does not have to go for a lengthy fasting. How does it sound, Miss Mary?
Yes, nurse. I got a better idea now. Thank you so much for your explanation. What do we do after getting the result?
That is a reasonable question from you, Miss Mary. It is better to make an appointment with her GP so that we can discuss the result with him. Also, you can review her current medication. Along with that, you can plan her for the treatment. In addition to that, it is highly important to accompany your mother during the blood test and follow-up appointment with her GP because she needs some physical and emotional support. So, will there be anybody to accompany your mother and follow-up appointment?
Sure, nurse. I'll be with her always. Thank you.
I really appreciate you for that. Do you have any more questions for me?
No, nurse. Thank you so much for your valuable suggestions.
I would like to summarize what we have discussed until now. So far, we've been discussing the blood test and its importance, along with its fasting requirements. I hope I have clarified all the concerns and queries. If you have any more questions or concerns, you can contact me at any time. I'll be happy to help you. Thank you, Miss Mary, for your visit to our clinic. I wish you a great day.
Thank you, nurse. Thank you very much.
Thank you, guys. Our role play ends here.